Welcome back everyone to another one of my vlogs. I'm actually starting this vlog out to talk to you about my cancer story. So if you've been following me, you know that I have had cancer twice. I had a robotic hysterectomy, a full radical hysterectomy, and that was, I believe, about 1.5 years ago. If you want to listen to that story or watch that vlog, I will leave a link in the description below, or you can look under my videos tab. Anyway, I thought it was important to address that 1.5 years later, because there was actually some important information that I didn't know at the time. So if you're going through a hysterectomy, or you know someone who's going through a hysterectomy, I think this is important to think about. So a lot of times we hear that you can go back to work in like 2 weeks or a month or 6 weeks or something to that effect. And it just really depends on the type of hysterectomy and how many pieces of the body are removed. For example, I had a full radical hysterectomy, which means everything was taken out, including part of my vaginal area, my cervix, my uterus, my fallopian tubes, everything. So they had to fashion what they call a cuff on the upper part of my vaginal area and sew that closed so that my internal organs wouldn't just like drop out of me, right? I don't know if any of you know this, but at any time after the surgery, even many years later, there is always a very small possibility that you may have an emergency regarding that area of your body. So if you feel really full or bloated or having, severe pain, things like that, you should probably go to the emergency room. I did not have this happen to me, however, I wasn't told about this. So, because your intestines are right behind that area. So if you have a tear, a rupture of some sort, then it's an emergency situation and you should go to the emergency room just to be on the safe side. And I'm not talking about gas pains or, you eat something bad and then you end up, in the bathroom for an hour or so. This would be a different type of pain. Maybe there might be bleeding, a really heavy full feeling when there shouldn't be, something like that. So that's something to keep in mind after you have a full radical hysterectomy. Another thing is it takes longer than 6 weeks, 8 weeks, 10 weeks. It takes 12 whole weeks to recover from a full radical hysterectomy. You should not try to lift anything above 5 pounds that entire time. And I wouldn't even advise lifting over 10 pounds after that for quite some time. I wouldn't do any strenuous exercise. When it comes to going to the bathroom, I would suggest using the, I believe it's called Miralax. I forget it because I haven't used it in so long. There is a warning on that bottle that says that if you use it for a long period of time, your muscles might get lazy and may not work as well on their own. I would not worry about that warning, because pushing too much or getting plugged up and not being able to go to the bathroom when you're healing from something major like that is far more serious. I thought it was important to mention that. Also, I was not told that my cervix was taken out and that I had a cuff. I was under the impression that I would be healed in about 6 weeks, 10 tops, and nobody mentioned that my cervix was taken out or that I had part of my vaginal area taken out, that I had a cuff and I had to be more careful. So I wasn't. And that is serious. I even checked my paperwork and it didn't mention the removal of my cervix or anything like that. I came to find out later when I was checking on a symptom, which was I stopped taking the Miralax and was having a little bit of an issue and started to bleed a little bit again afterwards, that I might be having a situation. So I called the nurse, and that's actually when I found out that I had the full radical hysterectomy and did not have my cervix there, so I had to be much more careful. So I think those are really important points to talk about. I also wanted to show you what it looks like after you fully recovered, scar-wise. It's practically microscopic. You can't see my scars unless you really look up close and you're searching for them. So this is what my scars look like after surgery. You really can't see them that well. I have had quite a few children. So, and I am older, so my stomach isn't beautiful like a 20-year-old that hasn't had kids, but you know, you can see that you really can't see anything at all. Another thing I should tell you about is that your vaginal area can close up if you're not sexually active or you don't have like a dilator to keep it open. So this is a medical dilator, they call it, and it's just a piece of plastic, and it's about like an inch in diameter. And you just gently put this up inside your vaginal area until it just hits some resistance, and then you stop. You don't want to go past, you don't want to push it. So for me, it goes up to about here, okay? And then it hits a dead end, right? And that would be my cuff. But this keeps my vaginal area open so that my gynecologist person can check to see if I have any other cancer cells forming. And I actually did, and this was about 5 months ago. I had to go through a second surgery 5 months ago to have more tissue removed because I had 3 areas on my vaginal cuff that were developing cancer. So also it was difficult for them because my vaginal area had closed up. And it was starting to do that pretty quickly after the first surgery too. They had to open it up a couple of times. So they did give me this, and I am supposed to use it once or twice a week. And on here it says to use it for 10 minutes. I really have only been using it for once a week for like 2 minutes. And it seems to be doing the job just fine. But this is something to note, right? I think you're gonna have to ask for this just to be on the safe side, but I wouldn't use it until after you're fully in the safe zone from healing, when your oncologist tells you you can use it. So these are really important tips that no one else that I've noticed on the internet has spoken about, and I probably took too long in sharing this information, but at least today you're getting that important info. Also, if you're worried or scared about this surgery, try not to be. Try to envision everything going just fine. There's no sense in having anxiety or panic or, depression over it, because this is not something that you can control. The fact of the matter is, we're lucky that we have the medical advancements that we do have, that we can have this robotic surgery, which is, doesn't leave a big scar. The healing time is much quicker than if we were to, just slice open that whole area. And we're lucky that we have the advancements to detect these cancers and save our lives, right? It won't hurt you. You will simply fall asleep. Everything will be done. You'll wake up and the nurses will be there. You won't be sore or in pain, and you'll just follow the instructions, move slowly, don't lift anything above 5 pounds, and just let yourself have the opportunity to recover. If you work from home on a phone or a laptop, you can certainly start working again within a few days. I did. But limit that, and make sure that your head is clear from the anesthesia, because sometimes your head is not clear for up to a week or 2, depending on, the person, because we're all different. We all react differently, and they use different types of anesthesia. So you can ask your anesthesiologist if you have any questions about that. So, okay, so that's it. And thank you for joining me today. I hope that you got a benefit from this information. And once again, if you would like to watch my cancer journey or see, you know, me at the hospital when I was getting this procedure done, then check the description below for the link, and or you can check the videos tab. Just click on that and there'll be like a playlist of my cancer story. Okay, thank you for coming. See you later. Bye.